Sign them up or pay up when it comes to Obamacare and the mandates. Our John Roberts finding one company that is choosing the fine. John?
Good afternoon to you, Stuart. This is a classic example of the unintended consequences of the new Obamacare law. Debbie and Larry Underkoffler built a boutique staffing agency in the heart of the economic downturn. They now have 18 full-time employees for whom they provide generous health care benefits. The 400 or so temporary workers that they manage can buy into a separate program. But when Obamacare kicks in, the employee formula lumps all of the employees together, including all those temps, which means their effective full-time staff will go from 18 to about 200. Under the rules, they either have to provide health insurance for all of them or pay a fine of $2,000 a year per employee. The Underkofflers say there's no way they can afford to carry insurance for everybody, so they will pay the fine instead.
Typical single coverage plan is about $800. Typical family coverage plan is about close to $1,000 per month. So the fine, which would be only $166 a month, is way below the cost of the program itself.
Another effect of Obamacare on their business, the Underkofflers can no longer have that separate benefits program for their full-time office staff, so every one of those employees will lose their current benefits and be thrown into Georgia's federally run health care insurance exchange. The Underkofflers say they're angry that they worked so hard to build a business that puts people to work, and now the government is coming in telling them how to change the way they do business and negatively impacting many of their valuable employees, Stuart.
All right, thank you very much, John Roberts. President Obama promised you could keep your doctor under his law, but that may be hard to do if your doctor can't keep his or her job. A new report shows the healthcare industry slashing 41,000 workers in the first 9 months of the year, a 58% jump from the same period in 2012. And Dr. Manny says it's going to get even worse. Absolutely. First of all, Doctor, is this the result of Obamacare?
Absolutely. For the last year or two, the healthcare industry has been looking at what's coming. So they were not sure. They know for a fact that there's going to be mandates that they can't cope with. There's going to be a lot of new patients. But they don't know how much they're going to get paid. At the end of the day, the Obama administration is going to focus on two things. Quality of care, which, you know, it sounds like it's the right thing to do, but at the end of the day, it penalizes hospitals and doctors if something goes wrong.
Are they saying we're not going to pay hospitals which have a lot of return visits or where they suspect the quality of care?
Certain complications, and even a report card. You know, the report card usually goes, you fail, fair, good, excellent. If you don't get an excellent in every report card under the federal guidelines, you don't get any credit for it. So it doesn't matter that you do a good job or a fair job, you don't get any credit. So at the end of the day, everything is really looking at minimizing the payments to hospitals, to doctors, and therefore, for the last year and a half, every hospital in the whole U.S. has said, we're not hiring.
But if you do that, we're not hiring.
Right.
Lay off 41,000
we're going to lay a lot of people off. Right.
Doesn't that make patient care quality even worse, which means they don't get an excellent rating?
True. It overworks the people that are already in the hospital. If you ask any nurse in America today, and you know who you are out there, they will tell you, listen, we can't cope with the amount of work that we have. So they themselves are complaining. You know, they're writing letters to the state legislators. They're writing letters to the Department of Health because they know that they're not working in a very safe environment. At the end of the day, this is going to come full circle because once you start getting 20, 30 million people back into the system again, all of a sudden, well, I don't know what hospitals are going to do.
You know,
but it's not their fault. It's because they don't know what the rules are.
But we were told that the healthcare industry generally favored Obamacare. No?
I think that they favor the concept from a political perspective of healing people, of including people in the healthcare system. That's a noble task, but they are petrified of the rules and regulations.
Petrified?
Petrified.
Strong word there,
with the capital P.
Got it. Dr. Manny, thank you very much indeed. Setting us straight there. We do appreciate that. Lots of talk about compromise to pass a deal on lifting the debt limit, but one lawmaker still says not raising the limit would send the world a much better message. Congressman Ted Yoho, he tells you why tonight on FBN. That will be at 8 p.m. Eastern Time. And I will see you tomorrow morning on the Fox Business Network. That will be Varney and Company. We arrive on your doorstep, in your living room, wherever, promptly at 9:20 Eastern. Terrific show. I can recommend it. The 5 is next.